Hello everyone, so in today's video we're gonna talk about pulmonary bronchiectasis. We're gonna talk about what is it, the definition of bronchiectasis, its types, then we're gonna discuss some cases. So bronchiectasis is characterized by dilation of bronchi, and it can be caused by infection, congenital abnormalities of airways, and pulmonary fibrosis. And although the location and distribution of bronchiectasis can help narrow the differential diagnosis. And also there are some other features such as mucus plugging, air fluid levels, and fibrosis. So there are some common clinical symptoms of bronchiectasis in case of lung infection, like difficulty of breathing and persistent cough. And the cough can get worse when the person lies down on one side, and in some patients they can cough up blood. And we have other symptoms which are uncommon, like breath odor, or shortness of breath, or chronic cough that brings out mucus, and fatigue and wheezing. Then here we're gonna move on to types of bronchiectasis. So mainly we have 4 types of bronchiectasis. 3 of them are mentioned here, and 1 is not mentioned. So we're gonna start with cylindrical or tubular bronchiectasis, where we can see some smooth dilatation of bronchi without tapering. And the second one, which is varicose bronchiectasis, where we see some dilated bronchi with the sites of constriction. And cystic or saccular bronchiectasis, where we see ballooning of bronchi into linear arrays of cysts. And the other type, which is not mentioned here, which is traction bronchiectasis, where the irregular bronchial dilatation is due to traction by adjacent fibrosis. Then we're gonna move on to radiological features, starting with cylindrical type. And here we have 2 images on X-ray and on CT. So starting with features of X-ray, where we see some dilated bronchi, which may produce a tram track appearance formed by parallel thickened bronchial walls. And on the CT, the bronchi in the plane of the image will appear tubular without tapering, and the bronchi cut in cross section will demonstrate the sinus ring sign, where we see a dilated bronchus accompanied by the smaller pulmonary artery. So for more clarification of the tram track sign, here we have 3 different images. The first 2 images are done by high resolution CT, an axial image, and there is some curved sagittal format of the chest in the third image, which the first 2 images, they reveal loss of tapering with uniform dilatation of the posterior segmental bronchus of the left lower, classically described as the tram track sign. And one more thing, please do not confuse sign ring sign and Trump truck sign. So as we can see in these two images, that the sign ring sign, which is viewed in the transfer plane, uh, we see that the dilated airway lies adjacent to the pulmonary artery branch, giving the appearance of a ring. And in the Trump track sign, we see that the dilated airways are seen in a horizontal orientation. Then we will move to the second type of bronchiectasis, which is varicose, which implies non-uniform bronchial dilatation. And on the city, varicose bronchiectasis will demonstrate a beaded appearance when seen in the plane of the image. And this beaded appearance is called a string of pearls sign, but maybe mimic cylindrical bronchiectasis when cut is seen in cross section as is shown in these images. And here we have the cystic type features, which are seen on the plane radiographs as clusters of cysts, and on CT it can be seen as strings or clusters of cysts with discernible walls. And also the superinfection will produce air fluid levels in some cysts. And here we have four images of the same patient. So the first is X-ray image, image A, which demonstrates multiple cystic structures in the lungs, particularly in the mid and upper zones. And on the image B, where we have more closer view of the grossly dilated bronchi, and corresponding to the coronal city chest image C, we can see this dilated bronchi much more clearly. In addition, in the right lung, you can see one of the typical CT signs of bronchiectasis, known as sign ring sign, where it's outlined here in the yellow circle, and which is more clearly seen in the image D. So, traction bronchiectasis. It can result from structural distortion and fibrosis of the lung parenchyma, and it may be seen in any of diseases that result in end-stage lung diseases such as idiopathic pulmonary fibrosis, collagen vascular diseases like acistosis and systemic sclerosis. And also traction bronchiectasis is commonly seen in the upper lobes in patients with prior TB and chronic interstitial lung diseases related to sarcoidosis. And for traction bronchiectasis, the fibrosis and volume loss can occur in the radiation field following external beam radiation therapy. And here we have in the first image where we have the high resolution CT, which shows some fibrotic changes which predominate in the lung bases and subpleural regions. They are associated with honeycombing, which is shown here in this image as with orange arrows, and traction bronchiectasis, which is shown in the with the yellow arrows. Then we're gonna move on some cases discussion. So here we start with the first case, where we see or we have the chest radiography, which reveals some cystic change in the right upper and middle lobes, and the transverse chest CT scan, which shows total atelectasis and severe bronchectasis in the right upper lobe, and the image C, it shows the bronchectasis in the right middle lobe. And the second case of Cohen syndrome, we can see that there is some extensive bilateral reticular and ring-like opacities, where some of it are showing some air fluid levels within them. And we notice that the cardiac and diaphragmatic borders are indistinct, and the suspicion of tracheal widening. Then for the second case, it's chest x-ray. We see that there is some nodular dense opacification in finger in glove configuration overlying the right hilum and extending into the right upper lobe, and this is likely to represent a combination of hilar lymphadenopathy and infective consolidation. And in addition, there is perihilar consolidation on the left. This patient is predisposed to allergic bronchopulmonary aspergillosis. So thank you for watching, for your attention, and see you on the next video.